Thank you for that introduction, Lodi. And thank you. It is my honor to be here with you today. It clearly shows that the ASCP walks the talk with regard to incorporating the patient voice. I'd like to begin by telling you a little bit about my background. In 2006, I was diagnosed with breast cancer. The very day I was diagnosed, I went home and told my husband of less than a year. He agreed to help me in my fight. A half hour later, Ray had a stroke. A month later, I was forced to take him off life support. At 51 years old, Ray died of endocarditis due to an infected tooth. 1 week after burying him, I began my battle with breast cancer at the University of Michigan Comprehensive Cancer Center. Chemo, radiation, and years of adjunctive therapy followed. While I am in remission and completed the final phase of my treatment plan in 2015, I continue to struggle with the thoughts of reoccurrence and the many side effects caused by the cancer drugs. In 2013, my stepdaughter, pictured here, Tricia, lost her 3.5-year battle to non-Hodgkin's lymphoma. Tricia asked for my help in navigating through the health system and to support her in her journey. We tried desperately to get her well at University of Michigan. We even traveled to Texas, St. Louis, and New York. All failed treatments, which were experimental at the time. She died at the tender age of 23, and that is why we built a foundation in her honor, the Kachin Strong Foundation. All the proceeds from the fund go to the Wig Bank at the University of Michigan Comprehensive Cancer Center. In the fall of 2013, once again, I found myself in the caregiver role. Both of my parents had open heart surgery 11 days apart. On December 2nd, 2014, I lost my dad after a lengthy, protracted illness. My father had constrictive pericarditis, and his lungs really never recovered after the heart surgery. From 2014 through 2016, I took care of my husband, Bill. Bill had 2 occurrences of melanoma. He too was treated at U of M. After my father passed in 2014, my mom became ill. So once again, I found myself taking care of others. My mom had many illnesses, including pulmonary hypertension. She ultimately passed away last April 2019, of heart failure. I took my role as patient and caregiver in every one of these instances very seriously. Pathology was at the core of my care at U of M and in every other case. In fact, I think we would all agree that pathology touches every patient's life. So after the last casserole dish stopped coming in the house, I had time to reflect. I felt I had a greater purpose beyond these seemingly unbearable losses and tragic life events. I was convinced that these things did not occur by chance. I believe we can become a victim of our circumstance, or we can move beyond them, redefine ourselves because of them. I needed to give back. My prior work as a portfolio manager in the information systems area of Blue Cross Blue Shield of Michigan, where I worked for 25 years, has also made me uniquely qualified for this role as patient advocate. I retired in 2009. I really believe that nothing happened by accident. I was exactly where I was supposed to be. I've been volunteering at the University of Michigan as a patient advisor since 2013. Originally starting in the Cancer Center, then moving over to the University Hospital. But in 2016, I was given a wonderful new opportunity where I continue today as my role as co-chair along with Chairman Dr. Jeff Myers. This is by far my favorite role to date as chair of the Department of Pathology Patient and Family Advisory Council. I remember thinking that this was really groundbreaking new territory for Michigan medicine, and I wanted to be a part of it. Then I thought, why would these folks in the Department of Pathology, who normally hide behind their lab coats and microscopes, want to be interfacing with patients? Turns out, many of the pathologists do want to speak to patients. I was actually one of the first to volunteer for this activity. I never saw my cancer or my pathology report. I never thought I could, but I was always curious. I really wanted to see the enemy. Dr. Jeff Myers showed me my cancer 11 years after my diagnosis. It was very emotional for me, as I had been told it was small and no big deal. It was a stage 1. It was small, 0.9 centimeters, but the slides told a different story. Jeff did a great job of describing to me how it worked, how the slides were stained, and then he got to the part about grades. There are only 3 grades. I did not know that I had a grade 2 tumor. The sheer size of the enemy is what stays with me from this experience. Although it was not what I had expected, I am grateful for the encounter and the compassionate way that Jeff handled it. And the experience was transformative. As a result, I have made changes in my lifestyle, and I'm convinced it will have a positive effect on my health and my cancer long term. In a strange way, the experience with Dr. Myers extended a warm touch in a world filled with barcodes, sterile instruments, and starch white lab coats. I now have my cancer on my computer. Here it is. I framed it and I keep it on my dresser at home. You may wonder what the Department of Pathology Patient and Family Advisory Council has done in the last 3 years that we have worked together. Here's just a few of the items. Patients' advisors are working to provide training for pathologists who participate in autopsies where they deliver serious news. We're actually on the committee picking the vendors who are going to do the training. Patient advisors have been added to the patient safety meetings. These are meetings where we do root cause analysis and lessons learned when things go wrong. We just completed work on a video to show what pathology is all about. The 20-minute video takes viewers behind the scenes at Michigan Medicine's pathology labs with a former leukemia patient who is now in remission. Patient advisors are active participants and attend the Department of Pathology Quality Council. The Pathology Department has participated in the Patient Experience Expos at University of Michigan for the last 2 years, in which we spread the word about the impacts of pathology on diagnosis and treatment. Some potential future projects may include being part of the selection process for pathology residents. We're also hoping to kick off StoryCore, which is a project aimed at capturing audio conversations that illuminate the patient experience. The endeavor is part of a nationwide StoryCorp legacy project. These stories will also be permanently filed with the Library of Congress. In 2016, Dr. Myers and Dr. Allie Brown, Medical Director for the ASCP National Pathology Quality Registry, or NPQR, offered me an opportunity to participate in the Data Accuracy Task Force, which was one of the subcommittees for the NPQR database. I found the work very rewarding. And in January 2017, the Council voted to have me join as the first ever patient on the NPQR Steering Committee. This clearly shows the level of commitment the NPQR is making to improve patients' involvement through the decision-making process. In October 2018, I was honored to speak at the NPQR&U session at the ASCP annual meeting in Baltimore. In February 2019, I began serving on the ASCP Macro Grant Technical Expert Subcommittee. The Macro Grant is a $2.1 million endeavor to develop pathology-related quality measures for the Centers for Medicaid and Medicare Services Quality Payment Program based on clinical and patient perspectives. These measures will be added, tested, and validated in the NPQR software. And in June of 2019, Loti Mulder asked me to join the ASCP Patient Champion program. I'm very humbled and honored to be so involved with the ASCP. Next, I've been asked to share with you a little bit of my perspective on pathology and patient interactions. What patients should know about pathology. Pathology is at the core of every diagnosis. Patients should know that they have a right to see their pathology report and a right to speak to their pathologists. Understanding what tests are ordered and what the lab work means is empowering. Conversations with a pathologist can help guide you toward the answers you're seeking. Through the knowledge you acquire from your lab work, you will develop confidence that you're making an informed decision. Pathology tells you whether your treatment plan is working. Through the lab results, you're provided with some control over your disease. I think pathologists should respond to patients. These are just some of my thoughts from my perspective. How should pathologists respond to patients? Well, I think it's best if the conversation is face-to-face rather than by phone, if possible. After introducing yourself, you could ask something like, "What's your understanding of pathology?" to see if the patient is familiar with your role in pathology in general. Starting with an open-ended question is a good idea. For example, what's your understanding of your diagnosis? Asking them the first question is a sign of respect. It develops a rapport that allows you to learn what they already know so that you can begin in that place. This will also allow you to gauge the emotional landscapes, so to speak. Is the patient frustrated? Are they upset? Or are they angry? Then you can acknowledge the emotions. Perhaps something like, "You seem upset. This must be scary for you." Or, "I can understand how difficult this is for you." You then may want to ask permission to continue. "Would you like me to share with you what I know? It's not going to be easy to have this conversation. Are you ready to continue, or do you need a minute?" Sometimes their questions may be emotional responses disguised as cognitive questions. I think giving information in small chunks at a time is best. I would avoid using jargon or use it and explain what it means. Another technique, which you'll hear about in a little bit, is reflective listening. Using the same words that we are using, then repeat them back. What I hear you saying is, this does not mean you agree. It simply demonstrates you heard their ideas and goals. You can then check to see if it helped. Does this make sense? Or you seem confused. Am I reading that right? And finally, I love this last concept, hope and worry. I find this so comforting. I read an article recently about a softer approach to delivering difficult news. This concept in the article discussed hope and worry. I love the simplicity of it. An example of this technique is, I had hoped that your treatment was working, but I worry that the disease might have been progressing and we're in a different place now. I'd like to leave you with something to consider. I think we need to challenge those in pathology and laboratory medicine to see beyond the microscope, because behind every microscope is an anxious, sick, tired, scared person at the other end of that slide, that test, that specimen, that result. They're waiting and they're wondering, what are you looking at? What does it mean for their future and their treatment plan? You're the first one seeing that person's diagnosis, which will be life-altering. It should never be taken for granted. I am so grateful for the technicians and pathologists who examined my tumor, stained my slides, and determined that I had clean margins. For those in blood draw, every time I had to come to get infused with chemotherapy, they determined whether I would or would not be infused that day. These pathology-related areas are a few of the many in pathology and laboratory medicine who were critical to my recovery. They were the nameless heroes who saved my life. I will always be grateful to all of those who touched my case. I would like you to remember that no matter how seemingly insignificant and perhaps routine your tasks may be, please know that you make a difference every day, multiple times a day, in countless patients' lives. I'm so honored to be a part of this session. I applaud each and every one of you this late Friday afternoon for attending. You clearly have demonstrated that you understand the need for patient-centered care. I believe in the overall mission of the ASCP. That is why I've decided to participate in the Patient Champion program. I am ready to serve in whatever way I can to further the patient voice. After all, furthering the patient voice, I believe, is my purpose. Thank you so much for your time.